And I think that's really important to kind of keep that in mind, that this is really part of a whole picture. We're part of that community as well, and helping that community stay strong is really important. Talked a little bit about this earlier, but telehealth can also improve the perception of quality health care available in those communities. You know, the facility can now be viewed as a total health care center. You know, they're not just where I go when I break a leg and need to have that reset or to have it set. It's where I go for the full gamut of my healthcare services because the technology allows for that service to be available in that community. As I mentioned, the broader continuum of care is really critical here. And improving the health status of our rural communities. When a patient is comfortable in that facility, they don't really hesitate to come. And I think as we find out, you know, as many of you know, sometimes people just don't get the care. It's like, okay, yeah, I know, I need to go for that follow-up visit, but I'm just not going to go because I just don't want to go back. It's too confusing in that big town. You know, it's too difficult to get around on that healthcare campus. I don't know where I'm going. I don't know the people there. That, you know, I just don't know who to ask if I get lost. So people just don't go. And that in turn, then, you know, you have people with healthcare issues that don't need to have those issues because they simply didn't want to go get that care. So the other piece I think that is critical to the issues that we're dealing with is expectations. We have to figure out how to manage the shifting expectations. Right now we have we'll kind of go through these a little bit, but the patient expectations are shifting and changing. The baby boomers we'll talk a little bit about that, but they bring an issue. Also the children of those baby boomers bring their own issues. We've got technology, and of course then change is obviously a real critical piece of this. So, you know, it's interesting, we found out in many of our communities that, you know, the public knows enough about telehealth to assume that it's available. And if it's not available, they're starting to ask, why? They've heard about it in the news, they've heard about it on, you know, in the newspaper, on television programs. You know, they're seeing it, and you know, it's interesting now, we're starting to see telehealth and video conferencing in general being incorporated into TV commercials. You know, I cheered the first time I saw the Cisco commercial where they had just, you know, video conferencing as part of what was standard in their commercial. It was an expected piece. And I said, we've made it. Here it is. It's on a commercial. And so I think that the perception is shifting. And the expectation is that it is in your community, and if it isn't, why not? The baby boomers are a demanding group, aren't we? We know just enough to know that this should be able to help us, and we know just enough to think, okay, I know that this should be available, and that I should be able to, you know, for example, you know, see my physician in Minneapolis, and I'm in Sioux Falls, or I see my physician in Denver, and I'm in Rapid City. You know, why can't I do this? They're beginning to expect it, and now their children know even more about technology, and they know what it can do because they use it every day. They use it in their, you know, I don't Twitter yet, but I probably will soon. You know, they use it in their social networking, and it's expected. They don't see any reason why can't I email my physician? What, I can't email my physician? Why not? That doesn't make any sense to me. And so those are the things that are really coming, and I think we all need to figure out how we're going to be prepared for that. We also have to figure out how we're going to get comfortable with this technology. You know, not only the technology that we currently have. I mean, these are the things that, you know, are happening today, obviously, video conferencing, email, cell phones. You know, those are the things that we use regularly. Well, they also can be and likely should be in some levels and in manners be used in healthcare, and we've got to figure that out because the future is coming as well, and that offers a whole lot a whole list of other things that are equally scary for some people, robotics or robots in, for example, home-based care. There are, I have a clinical coordinator who lovingly calls this robot that she's anticipating having in her home when she gets to the age where she needs to have help as Pearl. And Pearl is going to be there to help her get up out of her chair and to help her make sure that she gets, the adequate foods that she needs, and make sure that, when she gets, can get into bed appropriately. If she falls, that Pearl will help her get up. Those type of things are coming and actually are not really all that far away. If you get an opportunity to go to the American Telemedicine Association, you'll see iterations of that today. Smart homes, I think we've all kind of started to hear about some of those. Understanding that there's monitoring devices that will allow for tracking of how many times the refrigerator door has been opened, how many times a person has gone into the bathroom, did they ever come out? Did they get up out of bed? Yeah. So, I mean, there are opportunities that are really on the horizon and are coming. And then, of course, nanotechnologies, and I don't have any clue as to what that is other than I know that they're there and they're really important and they're coming and they're being utilized. I know nothing about, the value. I mean, I know there's value in there, but I really don't know many of the details. That's one of the things that I need to get educated on. And then, of course, change. Change is always around us. Change is here. Change is tomorrow. Change is today. And we've got to figure out how to manage that. We need to figure out how to do a better job managing that change. For this, how do we change the seasoned professional? I use seasoned as opposed to old. How do we help them understand, get comfortable with this change? How do we also train the new professional to embrace this change? Are we training, for example, in the med school? Are we utilizing telehealth services and telehealth technologies in the training of these professionals? Or are we expecting them, once they get out of med school, to figure it out on their own? I don't know if that's the best method, the best process. We should be helping them understand these tools, what they can do, help them learn the skills on how to utilize these tools, how to interact over the technology appropriately. How do you engage that patient? How do you include them in their health care when they're at a distance? We need to figure out how to communicate and manage that patient remotely. I mean, those are the things and the skills that I think we really need to be educating our providers on. Change is coming. Change is here. The federal government is expecting and forcing change upon us. In 10 years, we won't recognize health care. At least that's my thought. It won't look the same as it does now. So it isn't a question of if change is coming, because it's here. It's on its way. So how do we encourage those around us to embrace providing health care services, utilizing telehealth technologies? I wanted to just share a little bit with you about, why do they use it? Those that do use it, why do they use it? Well, it's interesting. When you talk to, at least previously, when we talk to providers, they always said, patients won't be comfortable with this. This is just, this won't be where they would like to receive their health care. We've done ongoing patient satisfaction surveys, and we find that it is a high 98, 99% satisfaction rate. Patients and their families love it. They love the fact that they don't have to. If they choose to come on site, that's great, but they don't have to come on site for their health care.